Good afternoon, ladies and gentlemen. I would like to thank the organizers for their kind invitation. These are my disclosures. Now, there is no doubt that total knee arthroplasty is a satisfactory procedure. However, knees still fail due to aseptic loosening, infection, instability, and stiffness. And there is still a high rate of anterior knee pain, patella malalignment, and patella complications. The incidence of anterior knee pain in total knee arthroplasty is between 8 and 10%, historical controls, with either the patella resurfaced or not. It's interesting to say that 41% of the patients have been found to experience patellofemoral complications due to modifiable factors. Now, patellofemoral tracking in total knee arthroplasty is affected by surgical technique factors, implant design factors, and perhaps abnormal total knee kinematics. I would call them in our days sagittal plane instability mainly. Now, we know now in our days that there is a small anatomical variation in the trochlear, the femoral trochlear. In the old days, we were using non-anatomical implants. And now, most of the designers, they claim that their implants are patella-friendly. If you look at the literature, the definition is that the femoral implant is anatomical. There is longer and deeper trochlear groove. The groove orientation, it plays at the 3 degrees, and there is an elevation of the lateral femoral lip. Is this enough? I don't think that is enough, and I will make some comments at the end of my presentation. And not all the patella-friendly designs are similar by means of groove length and orientation and groove depth. To the best of my understanding, both implants, AMP and EMP, they are designed as patella-friendly components, and they have got an additive design feature that I will explain later on. Now, when it comes to resurfacing or not resurfacing, I think that is still controversial. You in North America have different views than us, but what I would like to say is that the outcomes are similar, but the failure modes are different, and they are serious confounding factors. And again, in my opinion, the patella-friendly design issue is unproved. Now, my personal database has got more than 3,000 of medial-pivot components. I started late in 1999, 3 months later than George. Now, we have evaluated our patients and we have published papers, but in all these studies, there was an important, in my opinion, finding that we were reporting lower rates of anterior knee pain as compared to historical controls. This was not the case with another cohort of patients that I have got with the Genesis 1 and 2 implant, CR implants, that they also claim that they are patella-friendly. For this reason, in order to explore this issue, we conducted a case. This is a retrospective evaluation of prospectively collected data. I always recorded my cases, and we published this study last year in Journal of Arthroplasty. We have compared 100 cases with AMP, another 100 cases of Genesis 2, and another 100 cases of AGC that they were not anatomical. The Genesis 2 is a J-curve type of CR implant, and the AMP is a constant radius implant. Now, we have chosen to start from 2002 because in the previous part of my cohort, I was not sacrificing the PS routinely, and I wanted to have a unique surgical technique. For the group A and B, the AMP and the Genesis 2, we have got both objective and subjective evaluation scales in regular intervals. For the group C, the AGC, the non-anatomical, we had got only KSS and radiological data. We have also separately evaluated the patellofemoral component with this simple 0 to 10 scale. We call it patella score. We have published it in 2000 in the Journal of Knee. Now, if we look at the results, KSS scores, at 5 years, no differences between the three groups were found. And I think that the conventional evaluation scales are not sensitive enough in order to pick up differences from the patellofemoral compartment. At 10 years and 15 years, the group A, the AMP, showed higher values as compared to the groups B and C. And again, we found similar effects at the level of 15 years. Now, when it comes to SF12, romack, and OKS, we have got data only for the two groups. At 5 years, again, no differences were found. At 10 years, the AMP was superior concerning the romack and OKS, Oxford Knee score. And then at 15 years, the values were statistically significantly higher concerning SF12, romack, and OKS score. Now, when it comes to the separate evaluation of the patellofemoral compartment, AMPs showed superior values, postoperative values at 15 years as compared to the other groups. And when we separated the two elements, the crepitus and the tilt, separately, pain tenderness, in a separate evaluation, again, we found similar results. Now, when it comes to survival rates, at 15 years, AMP had 97.3% survival rate for revision for any reason, and 1.1% secondary patella resurfacing. In contrast with the Genesis 2, we have got 3.25% secondary patella resurfacing, and the figures were quite high, 8% conversion in the non-anatomical femoral component. Anterior knee pain, 4.4%, only one with severe pain. This was the conversion, 7.5% for the Genesis and 17.2% for the AGC, non-anatomical component. And patella tiltel, we have got very good records for group A and B, and we had got patella subluxation and dislocation found only in group C, the non-anatomical component, 4.6%. Now, how we can explain these findings? One possible explanation is the lack of sagittal plane instability. It has been discussed. We have got data to support that these patients, they have a quadriceps efficient gait, the AMP implants, and single radius or constant radius implants, providing that the medial compartment is well balanced, they don't show mid-flexion instability. And now this is a case, I have performed this case 3 months ago, a male patient. During the operation, I have accepted asymmetrical balancing, extension delta 2 millimeters, flexion delta 3 millimeters. We asked the patient to step on a stair, and then we further analyzed these images with a model-based RSA method, and we have shown that we reproduce medial pivot kinematics with sagittal plane stability. Patella-friendly femoral components, the medial pivot, it is a patella-friendly femoral component. And the other dimension that I think that is very important to state in the literature is that patella-femoral components are not only the femoral groove, but you have to consider the geometry of the femoral condyles, single radius or constant radius, low rate of anterior knee pain, improved long-term clinical outcomes, better tracking, low rate of patellar tilt, low incidence of patella conversion. I haven't reported to you the lateral retinaculum release due to lack of the time, but we have, in our days, we very rarely perform releases. And of course, if you wish, you can leave the patella unresurfaced. Thank you very much for your attention.